There's a lot of conversation about individual freedoms, but then we have to counter that with a conversation that's happening on the other side of making sure that we're protecting our patients that are coming in through the door. So it really runs the whole gamut of both sides of the polarization on this issue. And at the end of the day, hospitals have to approach this with a viewpoint of what's best for our patients.
As the 89th Texas legislative session ramps up, lawmakers are facing a growing number of bills regarding vaccination requirements. Some of these measures look to prohibit vaccine mandates entirely, even for public schools and hospitals.
So at the national level, we see this is happening on things like polio vaccines, down to the state level trying to ban the requirement of flu vaccines in certain need-based areas. And that's the problem that we're really facing, is that we're trying to paint this issue with a broad brush, and it's just not helpful when we're trying to make sure that it doesn't preclude things that we know are proven science and good medicine. If we have a situation where we can't have our employees vaccinated on certain things, and that disease sweeps through a single ward, that's a huge issue that could wipe out an entire workforce in rural Texas. So really, it's something that we have to stay on top of and be vigilant on because it, at the end of the day, impacts our access to care for our patients.
In the 2023 to 2024 school year, Texas schools saw the highest percentage in the past 5 years of conscientious vaccine exemptions. Already in the first month of 2025, several cases of measles have been confirmed in Texas, all in unvaccinated children.
We have these diseases that have all but been eradicated in our communities in the United States over decades, proven medicine. And when you start to peel away parts of those over time and they start to come back, our communities are getting impacted by diseases that haven't been around for decades. So I think staying vigilant and making sure that we are constantly trying to prove out what the medicine can and can't do is important for our communities.